Washingtonians about our new efforts against the COVID-19 virus. Unfortunately, I have to report that we are experiencing an uptick in the COVID-19 virus activity in our state. And we know that if we are going to stop the spread of this virus, we need to remain vigilant and diligent and resourceful. As John Bell Edwards said, he's the governor of Louisiana, we may think that we're done with the virus, but the virus is not done with us. And I would like to share some information with you about why that unfortunately is true in the state of Washington. We're looking at a graph here, and this graph basically shows the R0 number. That's the number of how many people are infected when one person becomes infected. And this is produced by the Institute for Disease Modeling. It's a very accomplished group. We're briefed by them essentially every week. They do a very sophisticated analysis looking at all of the metrics that go into really figuring out what's going on with this virus. And you'll see that at the beginning, people who had the disease infected close to 3 people for every person that was infected. And when that happens, of course, the number of people who are infected explode exponentially. We drove that number down dramatically, as you see the curve go down as the time goes on to the right on the horizontal axis. And we did that because Washingtonians were committed and disciplined and caring for one another when we did our social distancing. Now, it was very painful for us because we had to shut some of our businesses in order to maintain social distancing. As we have reopened our economy, that social distancing strategy has not been available to us as we become closer to one another as we are reopening our economy. As a result, what we are seeing is that the number of people that one person infects is now going up. And you'll see in this chart that's indicated in the far right of the screen, the red line is the R0 number, the number of people that are infected per person who are infected. For Eastern Washington, the purple line is for Western Washington. You'll see that it is worse. It is a steeper curve in Eastern Washington. But in both cases, these lines currently in Washington are in the red zone. They're in the danger zone. And that is that they are over the number 1. And you'll see a horizontal line that both of these lines have crossed. That's the safety zone. And if you're below that line, fewer than 1 people become affected. If you're above that line, more than 1 people become affected. And when that happens, the virus spreads and increases its damage in the state of Washington. So unfortunately, I have to share with you that even though we have been resourceful and committed, as we have reopened our economy, as we have shedded some of our social distancing, we are now experiencing a higher activity of our virus. Now, is this just a hypothetical concern? Unfortunately, it is not. I want to share with you how bad this is and could become in the state of Washington. In Yakima County, which is the epicenter for this virus in the state of Washington, the healthcare system, because of COVID-19 infections, is so stressed that there is no room at the hospital in Yakima County. Repeat, there are no rooms available to people for this treatment in Yakima County. That means that patients are having to be shipped by ambulance outside of Yakima County to Seattle and other places. And it is so challenging that now we are going to have to engage a different service to transport patients out of their home county to get treatment. There's no room in the hospitals. This is something that we saw in New York. It's something we saw in Italy. It's something we're seeing in Yakima County today. And we do not want to see that condition spread across the state of Washington. So today we are adopting an additional and new strategy regarding the use of facial coverings in the state of Washington. We've seen people do that already. In Yakima County, only about 1/3 of people were wearing facial coverings a couple weeks ago. But just this last weekend, that's risen to about 60%. This is encouraging. It shows that we can adopt measures that can actually reduce the transmission rate of this virus. But we know that this issue is much bigger than Yakima County. So that is why today I'm joined by Secretary of Health John Weisman, who's signing a public health order mandating the use of facial coverings across the state of Washington. It will take effect this Friday, June 26th. As we know, willful violation of this order is tantamount to a misdemeanor. Now, as necessary economic activity increases and more people are out in their communities, it is imperative that we adopt further measures to protect us all. I think this is the way we need to look at this. We just cannot wish this virus to go away. We have to use tools that are available to us that we know that work. And we know that social distancing worked. That's why when we reduced our business activity and had the painful experience of closing our shops, the infection rate went down, and that worked. But that's a tool we've now put aside and want to put aside as we are reopening our economy. It's sort of like turning a screw. We want to turn this screw down and screw this virus down. But that's a tool we'd like to put aside so that we can reopen up our businesses across the state of Washington. But we have to replace that tool with something. And what we have available to us is a face masking way of doing business that we know works and we know people around the globe are now using. So tomorrow I also will be signing a proclamation specific to Yakima County that also requires businesses to require their customers to use facial coverings and does not permit those businesses to operate if they are letting their customers, selling products or services to their customers without facial coverings. Now, as far as the facial coverings we're talking about, it's everybody's style is acceptable. Any facial covering that can cover the nose and mouth will do in this case. Some are more effective than others, but we've seen evidence that they all help. And so what you choose is your choice. And we're just appreciative if everybody can think of this as a new part of the etiquette in our state. I think of these face coverings in some sense as a statement. It's a statement that when you wear it, it means you care about people, because it means you want to reduce the risk that you are going to infect another person. Now, nobody intentionally wants to do that, obviously. The problem is that we just don't know when we self have the virus. There's nothing frequently to indicate we have the virus, even though we're transmitting the virus. So when we go to the grocery store and we're feeling chipper and it's a sunny day and there's no problems, we may have the virus. We may be spreading it silently to people we've never met before or to our loved ones. When we wear a face mask, it is a statement that we care about other people enough to protect them from that potential virus. That's why it's so important, and that's why I hope people are now broadly join this effort. So in Yakima County, there will be a requirement regarding businesses, and we're going to move forward in the entire state. Now, when are these required? This means when you're in a public place for work or errands or entertainment. Inside, you're legally required to cover your face in most circumstances, and that's for the health of your neighbors and your community. If you're alone outdoors, that's okay as long as you're in a position where you can actually maintain social distance. But if you're at a bus stop, for instance, and you're shoulder to shoulder, packed in tight, even though you're outdoors, ought to put on a mask, because that'll help people. You get out of the car in a parking lot, you go into a store, you want to go into the bookstore, pop on the face mask. I think this is something we can get used to because we do care about people around us. Now, there are exceptions to this. I'll touch on those in a moment. But I do want to talk about why face coverings, and we'll have more of a scientific explanation of this, but suffice it to say that a large body of studies support the use of face coverings to reduce the spread of COVID-19, while simultaneously allowing us to increase our activities. So until a vaccine or a cure is developed, this really is going to be our best defense. Now, fortunately, we have something that's not expensive, readily available, allows us to do our business and enjoy ourselves, that actually can save people's lives, and it's available to all of us. But that's only if our leaders in elected office and their communities are unified and engaged on this. This is something where we can all be leaders. You don't have to be in elected office to be a leader on this. And it is important that we all lend a hand here, because if only 30% of us do this, we're not going to have the requisite protection in our community that we need to break this chain of transmission. I also note that masks cannot do this alone. We know we need to follow our previous health guidance, like physical distancing. It means that we've got to still wash our hands. It means that when we do our contact tracing, if you are positive and you get a call to help us find other people who may have been affected, it means that when we are asked to isolate, that we isolate so we don't affect other people. All of those things are still extremely important. But the one missing piece right now is this face mask, a strategy that is available to us. There are exemptions. Exemptions for those whose health might be adversely impacted by a face covering if there's respiratory problems. For those who are deaf or hard of hearing, specifically in instances when they're actively communicating. Children under the age of 5 are not required under this mandate. And by the way, the health officials are saying children really should not wear these under the age of 2. And from 2 to 5, it's recommended that if that's possible, we hope parents will do it. But the requirement does not start till age 5. Obviously, there's times where it's appropriate to remove the face coverings, even in public. That might be required in some recreation. It might be, obviously, it's required when eating in a restaurant. So that's not an exhaustive list. We obviously got to use our common sense. This order we will be issuing does not replace other requirements regarding social distancing, sanitation, and safety and health requirements. Our Department of Labor and Industry maintains requirements pertaining to this as for employees. So there are existing rules that will protect employees in their place of business that will remain in place. So I mentioned I've had Department of Health Secretary John Weisman here. We also have Dr. John Lynch from the Harborview Medical Center. And we have, which I really appreciate, representatives of some essential businesses to comment on this, including CEO of Costco, Craig Jelinek, as well as the president of the United Food and Commercial Workers 21, Faye Gunther. So I'm going to ask Dr. Weisman to make some comments. Go ahead, John.
Thank you, Governor. Appreciate that. As you said, COVID-19 still remains a serious threat, and the increasing number of Washingtonians who are leaving their homes for work and other needs really increases the risk here for COVID-19 exposure and infection. You know, over the last 4 months, we've learned a lot about COVID-19 transmission, most notably that people who are infected but are asymptomatic, that is, don't show any symptoms at all ever in the course of their being infected, or pre-symptomatic, that is, will show symptoms at some point, do play an important part in community spread here. And we know that somewhere between 20 and 40% of our cases are asymptomatic, again, meaning they don't have symptoms but can actually spread the virus to others. And we also know that people can spread the virus for 2 days, certainly before they develop any symptoms. And so all of this and this science supports that we use face coverings, and if we do that, we can limit the spread of infected droplets being passed on to others when we talk, cough, or sneeze. Now, in a study in March of this year, Ma et al. Found that homemade masks could block more than 95% of an avian influenza virus in aerosols. And similarly, a study published this month in Lancet looked at 172 different studies across 16 countries and continents looking at SARS and MERS and COVID, and found that face mask use could result in a large reduction in the risk of infection of viruses. And a recent study published in Health Affairs examined the transmission of COVID-19 right here in the United States and found that mandating the use of face coverings is associated with a reduction in the COVID daily growth rate. All of those things are good news, and the science continues to push us in this direction of using face coverings. Now, while some of us are wearing face coverings in public, we must accelerate our progress to best control this virus. Washington's strategy to restart the economy and get people back to work and staying at work will only be successful if together we act safely and follow these health recommendations. So today, as Secretary of Health, I'm announcing a statewide public health order requiring the use of face coverings, which will go into effect this Friday, June 26th, as the governor said. The required wearing of face coverings will apply when we are inside of or in line to enter any indoor public space, seeking healthcare services, waiting for or riding public transportation, and while outdoors when keeping a physical distance of 6 feet from others who are not in our household is impossible. As the governor mentioned, there are a few exceptions to this order, and he did a nice job of describing those. Again, I do want to emphasize for those kids 2 and under, they should not wear a face mask. Now, a cloth face covering is anything from a scarf or a bandana to a sewn mask with ties or straps that go around your head and behind your ears. You know, it's important to take proper steps to ensure we're using these and handling them properly. The face covering should fit snugly around your mouth and nose. So again, as I've been out in public, I've seen people who are wearing face coverings, which I'm really excited about. Sometimes I see people wearing those where they have them, their nose isn't covered. You just got to pull that up and get it up over the nose. And for my big nose, that's a good thing. Covering that up. And it should not have holes or tears in the fabric. Now, cloth face coverings should be washed frequently, ideally after every time you use them, but certainly daily. If you're not able to wash it after each use, then you should wash your hands or use alcohol sanitizer immediately after putting it back on so that if you do have the infection, that you're not spreading that having touched the mask by touching objects that people might come and touch after you. Now, wearing face coverings in public is simply another measure we can all do to slow the spread of COVID in our communities. In addition to using consistently these face coverings when we leave home, we must continue to wash our hands often with soap and water, stay home if we feel sick, and maintain a physical distance of at least 6 feet from others whenever possible. And I share sort of the governor's concern that with us reopening some parts of our businesses and economy and the weather being great, that people have forgotten that we actually have a pandemic, that we need to keep practicing these things. I've said many times throughout these things that life was going to be different. And this is part of what's different, our different life right now while the COVID virus is around. We simply have to take these different measures right now. All of these are critical steps to keep those around us safe, keep businesses open, and restart our economy. For folks who would like more information, you can go to the Department of Health website at www.doh.wa.gov/masks. And with that, Governor, I'll turn it back over to you.
Thank you, John, and thanks for your hard work and staff. They've been working really hard on this across the state. The contact tracers that are tracing people, the people who are helping Yakima County right now, the National Guard that are helping in this. Thanks for that Army or that are working on this issue. With that, love to talk to, I think we're going to Dr. Lynch now, I think. Yeah, let's go to Dr. Lynch. Dr. Lynch.
Dr. Inslee, thanks for having me on again. Well, you covered a lot of this ground very nicely, as did Dr. Weisman. So I'm going to hit some high points. I'm an infectious diseases doctor. I've been working at Harborview Medical Center in Seattle since the beginning of this epidemic. And I am a strong proponent of masks and the way they protect people in our community. So I'll just hit some high points here. As I mentioned, masks can save lives when they're used frequently and broadly. They can potentially save your life from getting COVID-19. It can save a member of your family who you may give COVID-19 to. And it can maybe save the life of someone in your community or your workplace. As Dr. Wiesman just pointed out, there are increasing numbers of studies that show that wearing a mask protects those around us as well as protects us. We are used to nurses and doctors and other people working in healthcare wearing masks to keep them safe. But as Governor Inslee mentioned, masks in this particular pandemic have two important effects. One, they prevent us from getting COVID-19. So some of those droplets from an infected person landing on our nose or our mouth, right? Or us touching our face after touching a contaminated surface. But really importantly, they also prevent transmission. So if we have COVID-19, we can prevent us giving it to someone else. And the data on this, the science behind both of these mechanisms is getting better and better, not only for the virus that causes COVID-19, but for other viruses like influenza and other coronaviruses that cause colds. So we know that this appears to work for lots of respiratory tract infections. So wearing a mask protects you and protects everyone around you. And as Dr. Wiesman pointed out, you can feel perfectly fine for 2, maybe even 3 days before your symptoms start with COVID-19 and be infected and be giving that virus to other people in your home, to your family member, to the person who can't afford to get COVID-19, at your workplace or out in your community. So as Governor Inslee mentioned, this is really also a practice that stands us up in our community. It tells everyone around you that you care about them, that you are taking the lead on this. And when more of us wear masks, all of us are going to feel more comfortable doing it. I was admittedly, even as a healthcare worker, very uncomfortable wearing a mask out in public. I remember my first day doing it, but I stood up, I did it. And because my community, my colleagues, my coworkers were all wearing these masks, I now feel extremely comfortable and empowered by doing this. My whole family does this. My community does it when I go to the grocery store, the hardware store, and so on. So the science is there. This is an important intervention, particularly as we see these numbers go up, as we see our healthcare system stressed in Yakima. We really need to respond in the way that the governor and Dr. Wiesman are pointing out. So thank you very much, Governor.
Thanks, Doctor. I think that if nurses and doctors can put their lives on the line, we can put a mask on, and I believe that we're going to do that. So thanks for sharing that. Craig Jelinek, CEO of Costco. Craig?
Thank you, Governor. You know, I'd just like to say at the beginning when this all started, COVID-19, we were one of the businesses that just didn't close. We were an essential business, and I can honestly say we really didn't know what we were doing. We stayed open. We had a lot of individuals got sick within our organization, within our Costco's. One of the things that we found out early on, we believed, based on we do other business in other countries, particularly Asia, that we should have our masks. So all the 95s that we had, we were going to use within our organization, but obviously the CDC came out and said you don't need a mask, and all these masks should go to the medical field, which we did. We donated close to 50,000 masks to the hospital field. And as times went, we continued to have illnesses. We decided that we were going to go out and go ahead and source masks and put them on our employees to just keep our employees safe from each other. When you have employees, they know each other. They don't understand what 6-foot distancing means because they think their other employee is safe. That being said, we were able to get enough masks. As of May 4th, we went mandatory masks for also all of our customers in every state that we do business, in every country we do business. And I can tell you that was not a popular decision because you were infringing on people's rights, which was the furthest thing from our mind. We felt that if our employees are going to try to keep you safe, you're also going to keep our employees safe and everybody around you. Now, things have changed in the last 8 weeks where all of a sudden masks are becoming very fashionable in other places like Arizona and Florida, where there was no mask rules whatsoever. My opinion, when we made everybody go mandatory masks, our spikes in positives and within our employees dropped considerably. Now, as things started opening up, they have gone up because a lot of our employees don't wear masks when they're away from Costco. So we've had some spikes, but all the spikes that we've had have come away from the work environment instead of in the work environment. You know, I can only tell you, I'm a firm believer you wear a mask anywhere that you go, and I believe in it. We show that it's improved overall our health and well-being within our employees, and I think it's the only way to go, and I support this decision 100%. So I'm not a scientist. I can only go by what's happened in our organization, and that's all I can add. Thank you.
Craig, it's very interesting, and I want to thank you for giving us your insights as we were developing this policy. We appreciate it. Faye Gunther. Faye.
Hi, thank you, Governor Inslee, for leading to keep our state safe. My name is Faye Gunther. I'm the president of UFCW 21. Our UFCW 21 members and all essential workers have been coming to work since the start of the pandemic, and these have been very difficult times for so many people. Our members want to ensure that their communities are fed and that their communities are cared for at all times. Our members are exposed to so many people at work each day and on each shift, and our members worry every day that they're going to get COVID-19 or take COVID-19 home to their family members who they love. We know that face masks, just like Craig was saying, are a powerful tool to prevent the spread of COVID-19, and they work best if we are wearing them all together. UFCW 21 members already wear masks at work for 8, 12, sometimes more hours a day. And we do this so that we can protect all of you, all of our patients and all of our customers. And I get it that masks can be annoying, they can be itchy, they can be hot, and it can be hard to connect with others. But we can get creative and get better options, and together we can really figure out the best way to wear masks and all do it together. We see you and appreciate you, each of you out there, that when you come into our store, our pharmacy, or our healthcare facility, you're wearing a mask. We want to stay healthy so that we can continue protecting our community and avoiding spikes that will impact our healthcare facilities, like what's happening in Yakima. Our shared sacrifice will help protect all of us. And we must get out of the danger zone, and we have to do that together. And I'm not a scientist either, but I believe in science, and the science is telling us that masks are the tool. And so I really appreciate your leadership on this, Governor Inslee.
Faye, we appreciate you keeping our families fed and working through this. We really appreciate always being there for us. And we know you're smiling under that mask too, so we appreciate that. I want to make some comments closing our discussion of masks regarding our News Monday. We have stood up our task force to address issues of policing and racial justice. This task force is part of a coordinated effort with legislators to develop comprehensive legislation that we have to take action on. I've specifically asked this group of people to start by developing legislation to form a statewide investigative unit for cases of alleged police misconduct resulting in deaths or serious harm to individuals. The task force includes community members, people who've lost loved ones to the police use of force. It includes hardworking members of the law enforcement community who want to be proactive and helpful in using what they know in this watershed moment where we can bend the arc of the moral universe towards justice. We know that more will be needed. Fixing police use of force investigation alone does not answer all of the needs that we know to deal with systemic racism and healthcare and the economy and education and more. But it is an important step, and I'm appreciative of the people who volunteered for the service to help Washington move forward, and I believe that we will do that. With that, happy to stand for questions.
First question comes from Rachel with AP. Governor, for jurisdictions that have already issued directives or guidance on masks, it seems like they use those as more of an educational effort in place of legal enforcement. So I'm just wondering, how realistic is it that there will be statewide enforcement of this requirement? And then also as it relates to Yakima, if businesses here don't comply, would their business licenses be at risk of being revoked?
In answer to the last question first, yes, in Yakima, because of the severity of this outbreak, not only is this a legally binding order on individuals and citizens, it is also a legally binding order upon businesses who have to have a business license to operate. And so there are sanctions for noncompliance, including loss of business license, or potentially fines, or potentially injunctive relief. And it is a fair thing to ask. If we're going to operate a business, we need to keep our patrons and our employees safe, as Faye Gunther talked about. So it is a fair thing to ask of our business community. And it protects, the business owners too, who are exposed to this virus if people are not wearing masks in their facility. So we think that is an appropriate thing for Yakima that has been such hard hit. To give you a flavor of how tough this is in Yakima for folks right now, the infection rate is 27 times higher in Yakima County than King County. If you look at a map of the United States, you'll see a few counties that are red or black, whatever it is. There's only like 2 counties in the whole western United States in as bad a shape as Yakima County. So this is an extraordinary situation. We're bending every effort we can to help the people of Yakima County. We're pleased that there's some bipartisan leadership on this. I talked to Congressman Newhouse, Republican from the Yakima Valley, today about his belief that he can help people see the way forward. The Chamber of Commerce in Yakima, County Commissioner Baker, the mayor of Yakima, they're all part of a Mask Up campaign. We've handed out, I think, 200,000 masks now in Yakima County to help people forward. Some of those came from the state, some of those came from the Chamber of Commerce, and I believe the city of Yakima. So we know we have to have a very concerted effort there, and this business requirement is just one part of it. Your other question, as far as enforcement, look, we don't want to have an enforcement of this. Ideally, there won't be any criminal or civil sanctions for individuals. We just think people will respond, as they had to our first stay-home order, where there was vast compliance. People pitched in. Washingtonians want to help each other. They do feel a commonality of purpose. And I think they understand science too. And the science now is very compelling that this works. So it's kind of a common sense thing. We're a common sense state. If you got a thing that is a matter of life or death, if you know you have something that works and it's pretty cheap to do it, and your neighbors are pitching in too, it's something I think people are going to get behind. And as I've indicated, they already are. We've seen changes fairly rapidly. I mentioned in Yakima 2 weeks ago it was a third, now it's almost 2/3 of people who are wearing these masks. Now we got to continue to increase that in Yakima and everywhere else for that matter. But this is something I think the fact that we care for our loved ones is what's going to really work here. Enforcement shouldn't be necessary. It could be used if necessary, but it shouldn't be necessary.
Rachel, would you like to ask a follow-up?
Following up on your previous guidance for businesses, you had required masks for employees starting June 8th. So did you feel like you had to take this next step because there was lax use of that guidance at businesses, or was it just because of the situation out of Yakima?
Well, it was more about the situation across the whole state. It's most dire in Yakima, but as I indicated, looking at the R0 numbers, the infection rates per individual, it's above 1 everywhere on average, both East and Western Washington. So this is not just a Yakima problem. That R0 number is in the red zone, in the danger zone, both in Western and Eastern Washington. And as I've said, this shouldn't be shocking to us that this has happened, because look, we had a tool that was working. That is, we had closed our businesses. We know that that was working. We now are removing that tool. We're putting it down. We're putting it on the desk. We have to have something to replace it. It's just not a surprise that this virus will come back if we don't have a strategy to replace that. So we're using one that is well known around the world to work, and that's the new tool that we're picking up. So it really was, no, it was not a response to, a non-compliance of our June 8th order.
Next question comes from Joe with the Seattle Times.
You said you might use enforcement on the masks outside of Yakima County. There are people with other unrelated respiratory issues. There's also concerns among African-American men who have been singled out by law enforcement in New York and other cities for not wearing masks. What do you say to folks who have those concerns about this new mandate?
Well, if there is a medical reason for not wearing a mask, you are not legally required to do so, whether that's a specific respiratory problem, maybe there's some circulatory problem. Look, if there's a physical reason not to wear the mask, you're not going to be required to wear it. What I'd say to the black community who have suffered systemic racism, we certainly understand that, but I just hope that people will think about their loved ones that they can save. And given the ability to save somebody you love, or even a stranger that you'll never meet, we hope that on that scale of things to think about, that'll be tipping the scales towards safety of everybody else around you. And that's effectively what you do when you're wearing a face covering.
Joe, would you like to ask a follow-up?
Yeah, we asked earlier about mask requirements and your thoughts on it, maybe a few weeks ago or a month ago. And I'm curious if your views on the science has changed or evolved, or if it's just based on the infection rates going up in Yakima County.
Well, it's both, and I'll just tell you this because nobody's asked me about this before. When this whole problem first came up months ago, I thought we should be wearing masks. I really did. I had many conversations with Trudy about this, my wife. But the science was not compelling at that moment, at that time, that masks had proven effectiveness. Since then, the science is becoming, I think, overwhelming that it can benefit people. So the science has now supported through scientific assessment wearing masks. So, but it is also now a position is we had a tool that was working. We were fairly confident it was going to work, and we were right. The social distancing that came with closing our businesses did in fact work. So what we did was working. It's just that we no longer want to use it because we want to get our hair cut and we want to go shopping again. But we just can't use that one now. So now the fact that strategy is no longer desired by us, we need a substitute. And fortunately, we have one. Look, if we did not have this mask as an alternative strategy and we still don't have a vaccine, we'd be in deep soup. But we have this, thankfully, available to us. All we have to do is use it. And I'm really happy that we're able to do this. And I do believe Washingtonians, as we think about this, will embrace this, and they've already started to fairly rapidly.
Next question comes from Keith with Coma.
Governor, how are you going to have this happen and not have neighbor turn on neighbor? When you first shut down the stores, the businesses, you had a hotline, you turn in violators. What are you going to have happen here when people see somebody without a mask? Are they supposed to call the police? Are they supposed to take action themselves? What's your guidance there?
Well, I think the best way to convince someone else to wear a mask is to wear a mask yourself. This is largely a cultural change, and one part of that is a legal requirement, and this is a legal requirement. We are hopeful that sparks sort of a cultural change. What's the etiquette? I can tell you that in many stores in Washington today, if you do go in without a mask, you get some second glances from people around you, just as you would if you went in violating some other sort of etiquette rule. And as we adopt more of the mask usage, I believe it will become more seen as a commonality and an acceptance, like it is in so many other parts of the world. So I think that that's what actually will be effective here. And as I've said, I think it is already helping. But this legal requirement is a legal requirement. You can tell your neighbor that if you'd like. This is not cause for anything more than a gentle word. But I think over time that will be enough.
Keith, would you like to ask a follow-up?
Did you consult with other governors around the country? Several other governors have done the same thing, California, New York, New Jersey. Is this something that you're in concert with them?
I haven't spoken to them. We did look at some of the other measures that other states have, and there's some similarities. There's a few differences. I think there's maybe 10 or 11 states that have some version of this or in this regard. So they're not too dissimilar.
Next question comes from Tammy with the Yakima Herald Republic.
Yeah, I just wanted to follow up on the enforcement. How is that going to be? I know enforcement is not, it's more of trying to get the word out to neighbors and friends and setting an example, but who would be responsible for enforcing that? The statewide mandate and the business requirements in Yakima?
Well, on the business side, we hope it's going to be the way the original stay home, stay healthy order was. And that was when businesses were said they couldn't operate temporarily. Huge compliance. Vast majority of businesses complied right away, frankly, even though it was very difficult for them and their employees. And we were very pleased by that. There were a few folks that did not, and they would get a call from a state agency reminding them of their obligation. And the vast majority of them, once they got a call, came into compliance. There were a couple that did not. They had to be sued. And when that happened, they came into compliance. I think maybe there's one or two litigations still pending. I'm not really sure on that. But their licenses can be suspended. And if people do not comply with the law, then there are both civil and non-civil penalties that are available, including in the thousands of dollars. But that just didn't happen with any frequency during the first effort. And we hope that we'll have similar success in this regard. Again, on the individual situation, it is a misdemeanor not to comply with this order. But it is not our desire to have hardworking officers following people around on mask issues. They have other things to deal with, frankly. And we hope that people's common sense and recognition of the law and desire to help their fellow neighbors are going to carry the day here. And as I said, we just got to accelerate that movement that is already taking place.
Tammy, would you like to ask a follow-up?
I think I'm good, thanks.
Next question comes from Jim with the Spokesman Review.
Governor, I'm wondering under what circumstances would you consider extending an order like the Yakima County order to other counties that are seeing a rise in cases right now?
Well, as unfrequently, we don't have an exact single number that would lead to that. But if we do see counties where the medical system could potentially be compromised because of the surge in cases, certainly that could lead to an extension of the Yakima-like ruling to those counties. As I've indicated, we do have very great concern about Benton and Franklin County. We've seen some increasing activity in Adams and Spokane County. So we're watching that very carefully. So those things could happen if we continue to see an increasing rate of infections and positivity and threats to the hospital system.
Jim, would you like to ask a follow-up?
Yeah, just on the mask order, do you anticipate this masking being in place until there's a vaccine or a cure?
I think it is likely that that will be the case. Now, it's like everything else with this virus, it's unpredictable. If something happens, the temperature or humidity or something drives it down that would not require this, that's possible. I think it's unlikely. So I would think it's likely that this would remain in place until there's some other avenue or some other tool that comes along. I don't know exactly what it would be, though.
Great. Next question comes from Tom with Northwest News Radio.
A question for Secretary Weisman about stage 4 reopening and possibly, Governor, if you're providing input to the State Department of Health on that, I'd be interested if you chime in too. I'm intrigued given the trends we're talking about today that the first group of counties, the 7 or 8 smaller rural counties, could by the end of this week be ready to apply for phase 4, which represents practically normal life, except with masking now and social distancing. Mr. Secretary, are you actually going to entertain phase 4 applications?
Great, thanks for that question. First of all, when I issued the approval for the phase 3 counties, I was very clear with them that no decisions had been made on going to phase 4. And the governor and I and his team are having conversations around that. Obviously, I think we are very concerned about thinking about any large gatherings or opening up things that really encourage people across the state to travel. So we're in those discussions at the very moment. I think the main message I want people to take away from all of this is it is safer at home. It is safer to stay local. It is safer to still limit our interactions out in the public. This virus has not gone away. And doing everything we can when we are out and about, and using face coverings is one of those tools. So that's, I think, what I really want people to focus on, that it is still important to do the things we've been saying all along.
If you'd like my response, we do have concerns. I have concerns about if we have, raging outbreaks in counties in our state going to sort of a full-blown large gathering situation. That concerns me. So it is something we're giving deep thought to right now.
Tom, would you like to ask a follow-up?
And just a quick follow-up for Secretary Weisman or the Governor. At this point, then, can I kind of read between the lines to say there will be a delay, but I'm wondering if I should say a short delay or maybe a longer delay before the application for phase 4 will be made available to qualifying counties?
Well, I'm not sure if there's actually been applications now. I don't think so. John, help me out on that.
There are no applications yet. And again, I think I was clear with people on the phase 3 that decisions hadn't been made. There are some who, if we just simply waited the 3 weeks, could be eligible to apply at the end of the week. But I've been very clear with them that decisions haven't been made at this point.
Next question comes from Alexis with the News Tribune.
Governor, what sort of increase in cases are you thinking it would take for a county to be moved back a phase? And how much do hospital capacity and new hospitalizations factor into that calculus as opposed to the rate of new cases?
So as far as moving backwards, again, if we saw activity that we were unable to suppress with good masking and good contact tracing and good isolation, and we saw a curve that was going to lead to potential overwhelming of the medical system, that is possible to have to go back in phases. We cannot rule that out. But I look at it more from an optimistic standpoint. I believe that if we do mask up, if we do contact trace, if we do isolate, and if people use sort of individual common sense, we can avoid that prospect. Now, I note this common sense thing too, because it's important, I think. When you look at the scientific assessment of where this rates of transmission, it has a lot to do, we believe, with just kind of personal behavior. How many birthday parties do you go to and mix with people for 2 or 3 hours, and then you have a big spreading event? How many young people are going to the beach and hanging on the beach blanket with 10 people close to one another? And how much of that people avoid has a huge impact on these transition rates. That's as important as almost any legal order from the governor or otherwise. So if we show common sense and do these things, I really don't think there's a reason to believe that these phases would go backward. As far as how we weight these, that you've pointed out correctly several of the metrics we look at, and the best answer I can give you is all of them are important. Number of infections are important. Positivity is important. Relationship to the number and the type of person who's being tested, whether you're just testing a bunch of people in a congregate setting, or whether you actually have a cross-section of the community, the rate of new hospitalizations, the rate of fatalities, the number of ICU beds that are available, the number of regular beds that are available, the transport services, all of those are in the mix, and it's hard to say that one is any more important than the other, because they can also differ. The positivity rate may be an earlier warning system than the hospitalization rate, because it takes time for people to get to the hospital. And the hospitalization rate is an earlier warning than the fatality rate, because people, have sometimes weeks in the hospital. So you have to look at all of those and project forward. And what we're projecting forward on is we got two roads to take. We're at the fork of the road, and we got one we can take that's going to save a lot of lives, and we got another which is passivity and failure, and we do not want to go that one.
Great. Alexis, would you like to ask a follow-up?
No, thank you.
So we have time for 2 more questions. Next question comes from Jerry with the Everett Herald.
If I could, I'd like to put this question to Craig and Faye. We've been talking about enforcement. I wondered if each of you could explain to us, how do you anticipate helping enforce the mask rule? And we've seen customers in stores take their mask down or not put one on. So how do you envision actually enforcing this rule?
I'll go first. This is Craig. We had some difficult times at the beginning, and still we have to remind people to pull the mask back up. We've been very successful about giving you 2 choices. Either when you come in, you wear the mask, or we're not going to allow you to shop. Now, we can get away with that because we're a paid membership warehouse, and, people happen to enjoy shopping at Costco. But we have, and one of the problems also that is, you have people that do have legitimate medical concerns, and you have to make sure that, as the governor said earlier, you have people that start to police and other people, and you have to be careful of that. So there's not without some issues, but overall, we've been very successful to say, hey, please put your mask on, and I would say the first 3 weeks, it was touch and go. The last 6 weeks, it's been business as usual. So there's a learning curve to this, and you learn as you go.
Faye, would you?
I don't know if I can tell you, you just have to do it and deal with it, and at the same time, protect your employees from upset customers and protect sometimes customers from each other.
And I think Governor Inslee said earlier it's safer to stay at home, which we certainly agree with, but our essential workers cannot stay home. Our grocery store workers, our healthcare workers, our pharmacy workers, all of the workers that have been helping keep our society functioning during this pandemic. And so we have been trying to partner with as many employers as possible to educate customers and the general public about wearing masks, about staying 6 feet apart. We use the 2 shopping carts as a symbol of ways to stay distant from each other. But we plan to work even more closely with the employer community to try to really enforce wearing masks. And I would actually applaud Costco for taking the lead in ensuring people are wearing masks. It's different though. They have a membership there. Our grocery stores and our healthcare facilities often have all different kinds of folks coming in. We have some cracks in our society where we have a homelessness problem. We have other issues impacting our society, and people use the grocery store as a place to get a rest or to wash their hands. And so we really have to be working very diligently to ensure that those who don't have masks for whatever reason get access to them, and that there's a culture created, like a no shirt, no shoes, no masks kind of culture where people are expected to wear them when they're inside our healthcare facilities, our pharmacies, and our grocery stores. So we'll be working as closely as we can with the employer community to promote that.
Yeah, if I could just add something too, and I hope people will look at it in this lens. Look, this is new for a bunch of folks, and it's like anything else that's new. It's a foreign experience, and we got to think twice about it. But I just hope people will realize the people, when we put on a mask, when we go out, the people we are protecting, they don't have a choice. They're doing their job. The clerks at the grocery stores, the people at the postal service, the insurance agents, the booksellers, these people don't have a choice. They're trying to feed their families, and they have to be there to help us. And so we're basically saying, let's just help them and not expose them to this virus. That's kind of what this is about. So this is a personal thing to protect the people who are helping us. That's what the bottom line of this requirement is.
If I can just add one thing, this is Craig again. Normally when I still get a few emails, individuals who you're asking to wear the mask, they think that you're trying to protect them from getting sick, and you're not. You are, but you're trying to keep other people safe from them, and they don't really understand the respect piece of what you're trying to accomplish. They think you're taking it upon themselves to protect them from getting sick by making them wear a mask. And obviously people feel that you're stepping across what you're supposed to be doing, but that's not how it works. But there's still a real misunderstanding out there about how masks are supposed to work and what they do.
Yeah, I think that's an important point, because a lot of folks say, hey, let me decide about my own health, and if I want to take a risk getting this virus, that's my decision. But that's not the primary reason for this. It's that we want to protect somebody else. Your decision is affecting somebody else's health. That's where public health comes in, and that's what we're doing. Thanks, Craig.
Okay, we have time for one last question. Hannah, if you'd like to ask a question.
Hi, Governor. I wanted to ask you about the task force for the police reform and racial justice. Can you elaborate any more on a timeline, and also what you expect the discussion to include? For instance, would it include qualified immunity or any discussions about reforming the police unions?
Yeah, well, I think they're meeting first in July. They have not come up with their schedule yet. We wanted this to be a community-driven process. The majority of these folks are in the Black community, and we think that's appropriate. So we're going to let them sort of guide them as far as any timing. As far as their ambit, we've asked them to start with coming up with an independent investigation system, both whoever would do the investigation and the prosecutorial decisions. And that's where we've asked them to start. The legislature is also having a task force. They're going to start on some of the other issues. I suspect that both task force will end up addressing multiple ones of these issues, which is fine. Obviously, the investigatory part is only one piece of this.
Great. Any final words, Governor?
No, thank you very much. Please wash your hands and mask up. Thank you.